Hey guys, Dr. Connor here from Outbound Chiropractic. Today what I'm going to be demonstrating is a adjustment for the hip. Hip pain is super common, and one thing that we noticed, as we talked about in the last video, is that oftentimes it'll result from a misalignment happening in the pelvis. The hip joint actually attaches to the pelvis, so when the hip is off center and one side is higher or lower than the other, it can put a lot of stress and strain on that joint. So here's this adjustment that we're going to do. Basically, we just have the patient lying on their side, they're facing this way, and we get them into a specific position here to allow some movement in this joint here and allow the joint to actually adjust and get back into a better alignment to take stress off that hip. So this is how that works. Just get them into this position here, and all we do is we roll them and put a little bit of a pressure here, just like that. And what happens is that joint starts to open up, and it also takes a lot of that nerve irritation off, okay? The next thing that we'll do is, after we adjust both sides, you can face up this way, is that we'll look at the actual hip joint, okay? So I'm actually gonna lower the table here. And now the hip joint is where the thigh bone meets the pelvis here. And this joint is it's called a ball and socket joint. So it needs to be able to move in a lot of different directions. So one way that we test for that is we bring their leg up to a 90-degree angle, and what we do is we start to motion it. We're actually moving that hip joint. And what we notice is that this joint should be able to go to about 90 degrees, starting from here, and we're at about 45. So that's one area that we're going to adjust. And then this way, this is called internal rotation, should be going to about 45 degrees. Okay, and we're at about 15 here. So we're actually going to do a few different adjustments here. And we're going to utilize what's called the drop table, which means that this piece pops up like this. And what we do is we get them into the position where they're restricted, and we help to get a little bit further. Okay, so we do a few drops in that position, just like that. Okay, and then we do internal rotation as well, if it's restricted, of course, which this one, in his case, it is. Okay, one more. Okay, so after that, we just let the leg rest for a little bit, kind of reset, and then we recheck, okay? So we're at about 90 degrees here. Already, I mean, I'm not even pushing any further, and already we got about another 10 degrees on that. That's a really good change there. And then with this, with internal rotation, got about another 5 to 10 degrees there. So just after those few adjustments, after getting the hips back into alignment a little bit more, and then getting that ball and socket joint, the hip joint actually moving a little bit better, that's going to take a lot of stress off the hip and allow him to walk, jump, sit, just move around, and without as much pain. So as we start to do that on a more repetitious basis, we actually can get that correction done so that this problem doesn't keep coming back. So hope you guys enjoyed this video. Stay tuned. Next week we're going to be going over a patient testimonial where one of our patients with hip pain will be telling you about their experience here at Outbound Chiropractic. Thanks.